As of midnight last night, we have delivered 474,435 doses of the Pfizer COVID-19 vaccine across New Zealand. That's an increase of more than 80,000 on last week. Within that, more than 152,000 people have now received their second dose, meaning that they are getting the maximum protection from COVID-19 through their vaccinations. Yesterday, we delivered around over 14,000 doses again, so we're seeing a relatively consistent trend midweek to get up into those kind of numbers, and DHBs continue to track ahead of their plans in terms of delivery. We expect to hit the 500,000 doses mark within the next 48 hours. That's a pretty significant milestone in this phase of the campaign as we prepare to change gear heading into July, which planning is well underway for. I'm also delighted to be making today a reasonably significant announcement around our ongoing investment in COVID-19 vaccination. We are investing $1.4 billion in our COVID-19 vaccination program to ensure that every New Zealander can get a free vaccination. This confirms for the first time the amount of money that we've allocated over 2 years for the vaccines and for the vaccination program, and it does reinforce the magnitude of our vaccination program. It is one of the key pillars and key planks in securing our economic recovery. New Zealand will continue to face uncertainties over the coming year as COVID-19 continues to spread and evolves globally, and it's critical that we keep investing in our health response to keep New Zealanders safe. Effective and ongoing vaccination of the community will also unlock economic opportunities that will allow us to safely reopen our borders over time. Our health response has been strong and successful so far, but we take nothing for granted. The $1.4 billion set aside for vaccines and for vaccine infrastructure means that New Zealanders are well placed to meet the ongoing challenges. More than $1 billion has been allocated for purchasing vaccines and specialist equipment. $964.3 million goes to the manufacturers as part of the advanced purchase agreements and the COVAX facility that we are part of that's ensuring equitable access to COVID-19 vaccinations. $66.3 million is going into specialist equipment, including syringes, storage facilities like the ultra-low cold temperature freezers, and transport. The remaining $356.9 million has been allocated for technology to support the rollout, funding for district health boards, which makes up a very large portion of that, ongoing support for MedSafe, and to stand up our community immunisation centres. We've secured sufficient doses of vaccinations to vaccinate every New Zealander for free, but also to play our role in the Pacific. This is a big investment, and it is going to be the single biggest undertaking that we have ever asked our health system to do. In addition to that $1.4 billion, we've also invested $30 million into vaccine research and exploring the potential for future manufacture of these vaccines in New Zealand, and $75 million through our official development assistance program to support the Pacific and global vaccine access. In closing, of these opening remarks anyway, I want to acknowledge this week's significant workforce milestone with over 5,000 people now trained to administer the COVID-19 vaccination. A huge amount of work's going on behind the scenes to boost the numbers of trained vaccinators, and that work will continue. The Immunisation Advisory Centre started running the training for Pfizer vaccine in February. As of this week, it's 5,358 vaccinators who have completed that program. The vaccinators are working extremely hard to protect New Zealanders as our rollout continues to expand, and I want to thank them for their very vital contribution, and I look forward to seeing that workforce continue to grow.
So what can you tell us about the death that's been reported to come from the person who had their second dose of the vaccine?
Look, I've had some preliminary information, as I get with all of these things. It's being investigated by the coroner. There is... I don't know if I can actually say this, but so I won't. The issue is wherever somebody passes away or has an adverse reaction after receiving a vaccine, that is always investigated. That doesn't mean that it's linked to the vaccine. And sometimes there can be other good explanations for why something has happened.
So there's, preliminary information is that there is no connection to the vaccine.
Yes.